Hello, I'm Dr. T. Biju Singh, and I want to talk about high-risk pregnancy. So, what is high-risk pregnancy? Probably it's something I could casually say, which involves risk factors to the pregnancy, meaning to the mother, or to the baby, or to even both. We live in risky times, and when I ask myself, why do we talk about high-risk pregnancy? Probably it's because we are seeing an increase in the maternal age. So age seems to be the most impressing factor these days. We have women now who are getting married late or not getting married. Women who are choosing to have their babies even later. And those women who don't get married, well, they turn to certain assisted reproductive techniques like IVF, test tube babies, which itself is a risk factor. So when we look at maternal age, we recommend people to get pregnant between the age of 18 to 35 at the upper limit. But I would still say under 30 would be better. We don't want young teenage pregnancies either, because a lot of complicating factors are seen in that age group too. But any time after 18 to before 30 is what we would prefer. With advancing maternal age beyond 35, 40, the risk factors are much, much higher. So what are these risk factors? Well, we know that pregnancy brings out all the hidden things inside a person. So when you become pregnant, if you have a borderline diabetes or sugar problem, that will pop up. Your blood pressure, which was otherwise normal, when pregnancy comes along, your blood pressure also pops up, what we call preeclampsia or pregnancy-induced hypertension. We do also see high-risk factors in pre-existing medical conditions such as renal diseases, like problems that existed even before the woman became pregnant. So that holds true for heart diseases, for your blood pressure, which was there before your pregnancy, diabetes, which was there before pregnancy. They all compound and affect the pregnancy. So the pregnancy outcome then becomes a little risky. You could have small babies or too large babies, or with advanced maternal age you'll have congenital issues where you'll have defective babies. So our aim is to identify and probably try to guide people as to how to go about managing high-risk pregnancies. We also know that pregnancies can be complicated by the structures involved in pregnancy, such as the uterus, the cervix, which is the mouth, the passage, the baby per se, and the placenta and the fluids which are involved, such as the liquor. They could be less or could be more, what we call hydroamnios or oligohydramnios, which actually affects the outcome of the baby. The placenta could be placed low down and could cause bleeding, which again is a high-risk condition. Or the placenta could be in a normal position, up or back, but because of bleeding, the placenta bleeds from behind, what we call retroplacental bleeding. A condition called abruptio placenta could be harmful again for the baby. So all these factors, these medical coexisting factors, can affect the outcome of the pregnancy, meaning which you could land up with a preterm delivery, or you could land up with very small babies or very large babies. So we tell our patients to go in for pre-pregnancy counseling so you can try and identify whether you have such risk factors and what we can do about it, how we can prevent it or we can control it. So we have doctors who deal with these high-risk pregnancies, and we have centers which have the facilities to deal with high-risk pregnancies. One can actually determine to some extent whether one is going to have problems, and we have certain markers, certain ways of understanding how the pregnancy goes. And ultrasound is one very simple method by which we can assess the baby and see how the pregnancy is progressing. We can look for Down syndromes or certain trisomies that we're worried about. We have blood markers too, the double test, the triple test, quad test, penta test, and other more advanced tests are also available. We can take fluid from the the amniotic fluid, what we call amniocentesis, and look for abnormalities. We can do biopsies at 10 to 12 weeks, which we call coronary villus sampling, and understand the genetic makeup of this, the forming fetus, the baby, and identify certain untoward outcomes and then take necessary action before the pregnancy is too advanced. So definitely high-risk pregnancy is something that has come in today's population, and I was talking about IVF, where we see a lot of twin pregnancies or multiple pregnancies, triplets, and in these conditions we know that pregnancy as it is has risk factors, and when you have twins or triplets, the risk factors automatically become twice or thrice the risk factor. So high-risk pregnancies definitely are here. We have high-risk pregnancy centers where we have qualified doctors and equipment to deal with these problems. But nevertheless, there's small and very simple things that one can do, such as controlling one's diet, leading a very healthy lifestyle. Obesity is not good, definitely. So one should try to work on one's weight. The habits that people follow, smoking, drinking, stressful lives, causing hypertension. So probably these things are something which are under our control, and I think that's what all of us should try to educate our population as to how to prevent it. And then of course, please do go to your doctors, do your pre-pregnancy counseling, and when you're pregnant, be regular with the checkup, see that these investigations are done, and probably then we can keep high-risk pregnancies under some degree of check. Thank you.